Hi, everyone. Welcome back to the podcast. Welcome all new listeners, and welcome back to those who have heard my content in the past. If you want to know uh, why what you're doing in the clinic is not working and what to do to fix it, you need to tune into this episode. Before I go on to the podcast, what is bigger and better with life? Well, I'll start off with what's not better. Let's start off with my back. Recently flared up. If you follow me on Instagram, I just recently aggravated doing a 185-pound power clean, and I just caught it just a little bit off, and it is day 3 of recovery, and I'm about 40 to 50% better, but just navigating that currently. And that life is fantastic. My kids are doing great. It's about time to take my wife out on a date. Those of you guys know how passionate I am about this. I'm gonna maybe surprise her. We'll take her out for a nice little dinner. And that life is great. I am consistently training. My kids are in sports. My son Zach, that's a new one. We are going to be getting, well, we're currently in the process of getting Zach into lacrosse. If you guys are big lacrosse fans, this is new to my world. This is not something I typically uh like attend practices or even know much about. So excited to get him into a new sport. All right, on to this podcast. All right. So you're stuck. I know you're stuck, and it's whatever you're doing is not working and you're frustrated. And I don't want you to do what I've done for many, many years over. And I've helped a lot of sports PTs, and I don't want you following that same route. And I need you to listen to this, please, because what you're going to do right now is you're just going to repeat the same cycle. You're going to get frustrated. And I would like to save you months to years of your career path and all the time that you're about to waste doing the same things over and over and over again. There's an easier, simpler way, and I want to share that with you today. So the reason I'm doing this podcast is I want to save you. I want to help you. I don't want you making the mistakes I have, and this podcast will give you some of the 3 most fundamental things that I can tell you right now that would set you up for success and avoid the countless hours of like just mess you're about to get yourself into, and the frustration, and I don't want you thinking that this is not the profession for you, or your patients aren't the ones that are the problems. It's not just you, it's not just your patients. There's some fundamental things that you're missing inside your practice and the things that you're not doing. So I want to share 3 things to just change your practice with 3 small adjustments, and it will make the difference, a world of difference in your happiness and your fulfillment, your patient outcomes, about you going and being excited about going to work. And you need to tune into this episode, listen to the whole thing. I promise it'll be worth your time, and you will be reinvigorated and have a refreshing outlook on what it is to be a sports PT in today's economy, today's society, not inside your PT school old mindset of how things should be, how they would be, and how they're currently not. So I am here to tell you, you just need a little bit of a kick in the pants with 3 small things. If you're ready, let's do it. All right. So there's a lot of problems currently inside your practice, right? So you're frustrated, you're just not getting the result, right? You're like, gosh, I've tried everything that has worked up until now. This is the thing. I just heard it, and I had a one-on-one session with somebody recently, and I just heard this, right? So um everything I've been doing has been working up until now, right? I just can't seem to get this patient better. I just can't seem to do it. So you know what the first instinct was for this person? Let me just go take a new course on this. Let me just do this. I'm like, before you waste more money, more time, why would you go down that rabbit hole? Do you not see the clear picture? And they're like, no, why? This is always I've done it. So let me share something called the traditional model of learning for sports physical therapists. And I recently shared this, and I want to share with you guys on here. Number one, uh, we all after PT school. Let me guess. You want to start learning. So what do? The first thing you do is you take CEU courses. That's the first thing that you're gonna look at. Like what's tried and true about PT, and what are the CEU courses saying nowadays, right? Like that's the thing. All right, so that's the first one. And you go back to your clinical practice, and doesn't make the world a difference. So you're like, okay, there's got to be something else. Let me Let me see what else I can be doing. All right. So the next thing you do is you go to YouTube or Instagram. You're like, all right, somebody else out here has to be able to tell me that there's something else out here that I'm missing out here in this world. So you do that, you take the CEU courses, you go to YouTube, you go to Instagram. What else am I missing? I got this sports PT topics. What else is out there? And you do that, and that doesn't give you everything that you need. So the CEU course didn't do it. The YouTube and Instagram videos didn't do it. So you're like, all right, then let me try something else. Let me listen to sports PT podcasts. Let me do this, and maybe that'll change my perspective. That'll give me a little bit more insight into anything that I'm missing. All right, that didn't work. The podcast didn't do it. The YouTube video, the Instagram didn't do it. The CEU course didn't do it. So let me go to old school. Let me read some books and some research articles to be able to figure this out. Maybe somewhere in there I can find some answers to the things I'm still having struggles with. That didn't give you. So you're like, I want some a little more efficient. Let me just go to Google. Let me just Google a topic. And I have a recent upcoming topic I'm going to do for stem cell treatment. So I'll share that with you guys. But so you research topics on that, and then that didn't work. So you like ask coworkers and colleagues on, all right, so what's worked for you? I can't seem to find this. I can't. The course I took didn't help. The YouTube, Instagram videos didn't help. I went to the podcast that didn't help. The books and articles didn't do it. Google didn't even have it. So you must know the answer. You're an expert. You've been practicing 5 to 10 years. What am I missing? And so you go through this loop in this circle, right? So that's the traditional model of learning, and there's a couple problems with that model, and that's probably where you're stuck at the moment, right? You've tried all these things and you can't seem to figure out where is it that you're stuck, because you're like, I'm doing what everybody else is doing and I've been doing it up until this point. So what is happening? So typically people who get stuck at this process, the first 1 to even 5 to years of practice, this wheel works. I would say people start to struggle around year 3, where they're like super motivated out of PT school. You're just a sponge. You're just doing it all. And years 1 through 3, you've done the CU courses, you watch Instagram, you watch YouTube, you've done the podcast. Then you're like, that's not working. Year 3 is like you spend more time doing article research, you do more books, you start doing more things, you start asking more colleagues because you've figured out that you can't do this on your own. So you're a little more vulnerable. Now you're trying to figure out, all right, what's the answer? All right, fine. I'm willing to ask for help, right? That's the thing that most PTs don't want to do. I don't want to ask for help. I've done it myself. I don't need to do that anymore. Like, who needs help? I don't need to do that. I've been able to get up to this point. Why do I need anybody else? So, and believe me, and I've lived that life. And nowadays, I'm the most honest, transparent guy you can ask. I'm like, so grateful for anybody's help. I'm quick to ask for help. And I think I see it in younger clinicians, 0 to 5 years. They don't want to ask for help because they've done it, right. Where it was, you did the hustle and you've done it up until now, and now you're going to waste 2 to 3 more years of your practice going through the same struggles. That's fine. Whenever you're ready, go ahead and listen. All right, so you go through this thing, and by year 5, you're like, all right, I'm like tapped out. I clearly I'm not doing something right. What is the problem, Chris? All right. So that's the traditional route. And let me tell you what you're missing and what to do about it, right? So the first part is what you're missing. So if you look at this wheel, right? So you look at CU courses, you look at the content, watching content, you listen to content, you read content, you search for content, and you ask for more people, right? So there's a whole wheel in this whole process. So there's auditory, there's visual, there's verbal, there's several components of this, right? And so as a PT, where you get stuck is because you use these things, rightfully so, as a way to gauge your level of growth, right? You're like, all right, so I'm doing all these things so I can grow as a clinician. And there's a difference between growing and learning. And all the things, that's why I labeled it the traditional model of learning. When you're learning, you're taking in information. And I think we're always learning, right? So I have a 2-year-old named Jacob, and he's constantly learning in this world, right? He's just taking in information all the time. And that's what you're doing. You find yourself like if you're on a drive, you're going to listen to a podcast. If you're sitting down, you're probably going to read a book. If you're late at night, you're probably watching YouTube videos or Instagram videos on the content you want to be able to digest. Or during your lunch hour, you're probably doing that too. And then on the weekends, you're doing your CEU courses. That's pretty much your weekly outlook, right? Those are the things you're doing on the drive Monday through Friday. You're listening to podcasts. Your lunch hours or your breaks or evening hours, you're researching articles, you're doing those things. And maybe on your lunch breaks or your weekends or your nights, you're doing the Instagram and videos so you can constantly be learning. So all that stuff is coming in. And at this point, you get frustrated because like during like 7 days a week, I'm trying to take in as much information, but it's not translating to either having more athletes on my schedule, getting the outcomes that you want. And the three things you're missing. Okay. Number one, accountability. You're on your own. And truly what it comes down to is if you're on your own, you only can see what you can see. You have your head down, you're reading the book, you're doing other things, but you're not looking up and you're not seeing what's around you, what can be done. And that's not your fault. That's very, very classic. This is a very normal progress or process. And you only know what you know, and you don't know what you don't know, and you'll find yourself going in circles because your current path is the only thing that you know. And somebody like myself, I've been mentoring physical therapists for the last 15 years, right out of PT school. I went right into residency, and I was a CI very quickly. And I was already, after first year, I was already mentoring other residents. So for the last 15 years of my life, I've been mentoring people. And the one thing I can tell you is I get frustrated with, I'm working with clinicians. I'm trying to get them to understand what I'm trying to say. I'm trying to get their clinical practice to change, and I too get frustrated. And I'll verbalize at them like, I don't understand where's the breaking point, where's the challenge, where's the gap in your understanding with this. And then I'll try a different strategy, and I'll try a visual, hands-on. I work with pressure and how to like get them to mobilize a little stronger, and I go through a whole whiteboard session on how to program and do all these other things. And I show them a taping job and how much pressure should be applied on a certain strip. And all these things are very, very challenging. And as a leader, I encounter the same challenges that you do when you're practicing. And so when I explain these things to my mentors and the people that I seek a help from, they're like, "Whoa, well, just what you don't understand is that they're not understanding the way you're approaching it. I think you need to take a step back and do these." I'm like, "Gosh, really? That's the one piece I was missing. I couldn't believe it that I didn't see that." And they're like, "Yeah, because you're just so far in." And when I do that with clinicians, I get it. Like, you guys think it's so easy or hard in your current situation, but for somebody else who's been doing this for a long time, I know where you're at. I know where your struggle is. All you have to do is stop focusing on this and pay attention to this. I know you think you need this. Know you think you need manual therapy. You don't. You need more blank. Insert the next challenge. Or I think you need more help on the manual work and you need less on the exercise. Stop doing that. But you pay attention to the things that you like and you enjoy. Rightfully so. I get that. But the problem is you're only enhancing your strengths, and your weaknesses stay still on the left side of the bell curve. You're just not developing them. And so that's what creates this average clinician that you're becoming. We're like really good at some cases, maybe baseball, shoulders, elbows, but you can't do an ankle, hip, or knee for a soccer player. And that really puts you at a disadvantage from a professional development, a growth, a career advancement, whatever it is. You might think you're doing great, but I'm like, gosh, honestly, I think you can do more damage if we just work on your weaknesses. Stop working on the thing that you love. But you have, you only have a couple patients here that your schedule is empty with, unmotivated, sedentary people. So the root of it is, how do we get you more athletes? How do we get you more active people? How do we create an environment where your weekly schedule is filled with people that you want to treat? Well, that doesn't come with more shoulder, elbow, CEU courses and more baseball, podcasts and other things. And you're just wasting your time there. And I can see that because I can see where your storyline is. Just like you can help your patients, you see where they're stuck, and you're like, "Oh my gosh, stop doing that. Stop bending forward like this." And they're like, "How did you know that?" Like, I can see it from a mile away because I do this all day, but you can't see that for yourself inside your professional growth. And that's a frustrating part for somebody like myself who sees you guys just struggle. You do the same things, watch the same videos, take the same CU course, and you're just going over this cycle. I once heard this phrase, and I want it to stick with you. I've been practicing 15 years, right? And inside every single one of those years, I have developed significantly and exponentially inside those years. And right now is probably the highest peak of my growth as a clinician, as a mentor, as a business owner, everything. That's what I've been able to do. And I'm passionate about that. I've also seen clinicians who've been practicing for 15 years, however, have only been practicing 1 year, that same year, 15 times over. So they've only been practicing 1 year, 15 times. Whereas other clinicians like myself who take a great pride in clinical practice and professional growth have been advancing exponentially every single year. What am I not doing? What am I seeing? Finding mentors, doing other things to make sure they're successful. And you might say, well, I've been practicing for 5 years. You've probably been practicing 1 year, 5 times over. And that's frustrating because you're not really doing anything different than you were 2, 3 years ago. Do it, say, taking the same CU courses, listening to the same podcast, reading the same books, all because you like them. And that's not what you need right now. The first thing you need is accountability, that you can't do this on your own. You're going to struggle. You're going to go in a cycle. And I know you're going to be stagnant in your professional growth. And that's probably where you're stuck. That's what's missing. Number one is accountability. Number two is goal setting. How many times have you heard patients say, well, this is the year, I'm going to lose weight. I'm going to get more fit. I'm going to start exercising again. You're like, yeah, yeah, yeah. Sorry, Mr. Jones. I've heard this before. And they're like, nope, this is the year. Let me put it in context for you and what I can picture in your head. You ready? Um, this is the year you're going to register for the CSCS exam, right? Like this is the year you've been having it on your goals, your a little sticky note or in your refrigerator. I'm gonna register for that CS. I'm gonna take it this year. I'm gonna buy the book. I'm gonna buy the book this year. I'm gonna register. I'm gonna take the exam. I'm gonna sit for it. I'm gonna read the first chapter. I'm gonna sit for the SES exam on it. I'm gonna sit for the OCS exam. I'm gonna apply for that residency. I'm gonna like this is the year. This is the year. I know it. I know. And it hasn't happened. And it probably won't happen at the current rate you're doing. Why? Because you're just stagnant. You're doing the same thing and life just hits you. You got a new dog, you got a new car, your car broke down, you took a second job, you've met a new significant other. Like life just hits you and you just don't pay attention to your professional growth anymore. It's very normal. And I'm telling you, it just depends on what you want. You can be the stagnant professional and just cruise, but don't complain that you're not where you want to be. So it's a very interesting balance because you want to have a nice personal life, but you also want to have a nice professional life too. And that doesn't come with a lot of sacrifice. And what happens is as you get older in your clinical practice, you get more seasoned, you have more responsibilities. And inside those new set of responsibilities, you're still working the same amount of hours. Now you have less time to actually develop because as a new grad, you didn't have much responsibilities. Maybe you didn't have a car payment, you didn't have a home loan payment, you didn't have kids, you didn't have a dog. And so everything went into you and you were selfish. And as you have kids and do everything else, you're selfless. And so those same 40 hours plus your develop professional growth has to be split and shared amongst other people. So what do you do in that case? You become more efficient. You become more strict with what you need to be able to do. So you have to set targets. You have to work on a weekly schedule. What is it that you need? And you might laugh at this. You're like, really, Chris? Yes, you just haven't hit that point yet. You hit these critical points. And I just had a conversation with a team member that they were frustrated with the same process. And, like I said, ultimately, if you don't set targets and realistic goals, you're not going to move. There's no way, and I can't do that for you. I'm not there to sit on your couch and make you look at different articles. I can't sit and be on your phone and cut you off from a certain timeline of watching the stuff that you're already good at. I can't sit with you and force you to register. I can't force you to sit during your lunch and work on something. I can't force you to work on your documentation when you should be. That's not my job. My job is to set you on the path and show you what realistic and what a goal should be and give you those targets and just keep pushing you. And if you don't have goals, you will never get to where you want to be. So number one, you need accountability. Number two is you need goal setting. Number three is my absolute favorite, and that is clinical reasoning. Now, let me go through those phases again of all the ways that you learn traditional model of learning, right? Take the CEU course, watch Instagram and YouTube, listen to the podcast, read books, research on Google, ask coworkers, that whole wheel, right? So you do all of those compartmentalized. No one's helping you put that together. So you're like, oh, that's a great thing on elbows. Love that. Let me see this one on baseball, on mechanics. Great. Love that. Listen or watch the book on hip strengthening to improve pitch speed. Love that. What you didn't do was learn how to put that together. Are they in the off season? Are they in season? What are you going to do? What's a 6 week program? Are you working on hypertrophy? You're looking at general preparation phase. How does that fit into their season? None of that happens. And all you're doing is segmenting, taking pieces, and that's called learning. So the difference between learning and growing is learning, you're just taking information, you're a sponge. Growing is actually using and implementing that information. So let me ask you this. Are you learning or growing? Knowing that, right? Taking all these things, I call them the traditional method of learning. The difference between taking all this information and actually applying it is one word. It's called action. Your ability to create action and implement everything. You're probably not an action taker right now. You're just a sponge who wastes a lot of brain space and time on doing the same shit over and over and over again, which is you're just taking in information, not using it. Might as well, honestly, just not do it. Might as well use that as time to just not be on any media and think about life. Why waste the brain space if you're not even going to do it? Why? Because it's just a couple conversation starters. You're actually not going to do anything with it. So why do it? Use it for something beneficial. I don't know, volunteer time at a local shelter. Do something else. Go for a walk with your spouse. At least that time is being used wisely. My point to bringing this to your attention is that you're doing the same shit over and over and over again. Why is it not working? It's because you're not doing anything with it. You're not taking any action and you're doing it all the same, expecting a different result. That's just the definition of insanity. So before you go more insane, I want to tell you the three things. Number one, accountability. You need it. Stop trying to do this on your own. I would never advocate for that. Number two, goal setting. If you're not goal setting, you're just doing the same stuff over and over again to do it for no reason. And number three is you need clinical reasoning. You need to be able to put that together. If you're not doing those three things, that's the difference between unsuccessful people and successful people. Successful people, whether they are business owners, whether they are working in pro sports, whether they are clinician, a clinical director, or whatever it is, have those three things in their life: accountability, goal setting, and clinical reasoning. They have the ability to look at something and say, you know what, I want that. This is what I need in my career path. So I need somebody or something to help keep me accountable. Here's the targets that I want, and here's how I'm going to put that together. That's the difference between trying to take all these little bits and pieces and put it together for yourself. And that's probably where you're stuck. So here's what you need to do about it. Okay. I told you what's missing, told you what the problem is. You're stuck. You've been practicing 1 year, 5 times over. All right. Number one, here's what's missing. You got to work at what you're not good at. And, your strength is shoulders, elbows, and baseball, right? It's easily to get distracted and pay attention to more baseball because that's what you love. And right now, you're getting really good at the 10% of people that are probably on your schedule. It's easy to get distracted and research things that you like. And it's even harder to do things that you're not good at and actually invest the time and stay consistent with that. So figure out what you're not good at and work on some of those. Some would say it's weaknesses. No, I just think that's areas that if you don't clean up right now, you're going to have a problem getting better at your craft. You're only going to become a significantly tailored specialist in a specific niche with nobody on your schedule. So yeah, I think you can develop your strengths, but I think that you need to spend time on things that you're not good at, right? Not good at. So right now, write one or two things. What are you not good at that you need to be good at? Like, what are the three things that you're like, gosh, I am not good at this? Low backs, acute injuries, strength conditioning, wellness programs, injury prevention. What are you not good at that you know if you did, you would have more people on your schedule, more athletes on your schedule, more motivated people? That's number one. Number two, I need you to write out a full schedule, whether that's on paper or on computer, Monday through Sunday. What does your weekly schedule look like? Yeah, you can insert your weekly schedule at work. You work 3 10s, 2 5s, whatever it is that you do. Put those on the books. Now, at lunch hours, what are you doing? Probably on Instagram, wasting time on YouTube. Well, got it. Is there a better way that you can use that time? Great. Now, when's your cutoff for evenings? What are you watching Instagram or YouTube for? Now, if you're working on your strengths or sorry, on your weaknesses, that makes sense. So actually look at create categories that you need to focus on. Monday, Wednesday, Friday, I'm working on lower body because I know I'm not good in that, or McKenzie or manual therapy or whatever it is. Start working on and creating an outline on what does the schedule look like to identify and work on your weaknesses. What about once a month? Can you work on strength programs? What about one evening a week that you work on improving documentation and working on efficiency, working on corrective exercises, one thing that you're not good at that you're currently battling and you're struggling with, rather than here's what most people do across their week. Most professionals just going about this like zombies. Most people are stuck inside a week. They don't even know what they're doing. They can't even tell you what they ate for lunch yesterday because that's how much information they're taking and not doing anything with it. Ready for this? This is most people's schedule. They wake up, they start at work at 9, they wake up at 8:15 a.m. They probably stayed up late watching random crap on YouTube to distract them from real life. They were supposed to wake up at 7:45 or 7 a.m. to go to the gym. They probably slept in, didn't work out so well. They forgot to put gasoline in their car. So now at 8:15, now running a little late. Now they're going to be going straight to the gas station because they don't have any gas. They show up at 8:59. The patient's already there waiting for them. They didn't even look at their case. They're significantly behind. Now it sets the tone for the rest of the day. They're stressed. They have two new cases on their schedule that they weren't prepared for. They didn't know they had to work on a post-op hip scope. They haven't seen that before, so they weren't prepared. So that eval didn't go great. Outcomes didn't go great. They didn't have a note for a Medicare patient that they were supposed to see. Now they have to do that at lunch. So they're playing catch up. So there's no development now because now at lunch they have to catch up from the rest of the day. Now there's no time for anything else. They quickly look at a quick, Instagram video to make them smile. Great. They snack down that they forgot their lunch. Now they had to order a Grubhub or Uber Eats. And so now they wasted money and time and energy with no outcomes. They run through the rest of the caseload for the rest of the day. That didn't work out. They didn't get the workout in. They're exhausted after the end of the day. They didn't get a workout. So at the end of the night, they're not even going to do anything. They didn't even get to listen to any of the podcasts because they were such in a rush. At the end of the night, their partner, significant other, asked them to go out for dinner, even though they know they should be working on notes and a program for the next day. Let's go out to dinner and drinks with friends. They do that. They go home. They play on Instagram for 2 to 3 hours and they just repeat the cycle. And so in there was no growth, right? There was, these people, right? And whether that's you or anybody else who should be waking up at 6 to go for the workout or the run early in the day, listen to the podcast, develop themselves, relax, make a good lunch, have good fuel, meditate, do yoga, whatever it is, drive. They got the gas over the weekend or whatever it is, or they had plenty of time to do that. They show up to work half hour, 15 minutes early. They prep all their stuff so their outcomes are ready. They get everything done so they don't have to have notes during lunch. And at lunch, they're actually working on development, not catch up. They're actually looking at videos and YouTube's videos on to improve injury prevention because they have cases that in they would like to develop wellness programs for, or they're about to be discharged and know they can do something better for them and have patients who actually want to come back to them. And at the end of the night, they finish all their notes, they got everything done. Now they can go hang out with their significant other, knowing that they developed, they work on these other things, or even better yet, they can go for a walk and not have any distractions and really just have a good relationship for themselves. This person's working on themselves. There's two different humans, and you've seen them. One person's going to be successful. One person is going to be caught in that loop. And that first person I mentioned, who's just kind of playing catch up, no development, they forget things. They blame life. They blame everything that they just couldn't catch up. It's not easy. I don't like my work. I don't like my job. I don't like this. I'm frustrated. And all in the all, you're like, it's just you. You're the problem. Why don't you work on yourself? Work on your weaknesses. Work on you developing yourself. That's the problem. So they have no accountability to themselves. They have no targets and they have no sense of clinical reasoning. And so they're trying to do it on their own. They're like, I don't need to do that. I don't even need CEU courses. I can do it on my own. Like you just see this wheel and it's very frustrating. Some of you are probably smiling or laughing because you know some of these people. And it's frustrating me because I see them, they enter my courses and they want to get better, but they're just not committed. And so in your life, you need three things. You need the accountability in your professional career. You need the accountability. For somebody to you need to be able to work on things you're not good at, and whether that's your schedule, whatever it is. I said, one, work on things you're not good at. Number two, weekly schedule of professional growth that you want to accomplish. Work on, your lunches on Wednesdays or Fridays, or your first out of the month, you're developing a program. Doesn't matter. Within all of that, you're working on your weaknesses, you've created this schedule, and then lastly, now you're working on your short-term and long-term goals. Now you're doing it. Now you're like, okay, in 3 months is what I want to get better at. In 9 months is what I want to get better at. 1 year, this is where I want to be, to make myself grow, to know that I'm actually progressing and not just working the same year 5 times over. And for some of you, these three things are what you need, but it's not what you want to hear. It's what you need to hear, and you just really need this the kick in the pants. You just need somebody to tell you. You're like, yeah, yeah, I know. You're like the person who knows they need to lose weight. They know they need to put down the fork. They know they need to look at the scale, and they just refuse. So they just keep going to the gym, doing the same thing. And you're like, if you just had structure and actually came consistently and actually had a progressive overload, you'd be stronger, you'd have less pain, you'd be more active, and you wouldn't have the weight loss challenge that you're having. So all they need is accountability, short-term goals, and the reasoning on how to put it all together. The same thing everyone struggles with, and that's probably where you're stuck. And if things are not working, this is how to fix it. It's not more CEU courses, it's not more podcasts, it's not more things. It's three things that are simple, absolutely simple. And if you ask why harp on this, is because it's the thing that I see that most PTs need, and that's why they think that they need more courses, more podcasts. And honestly, that's why I design my CU courses the way I do, to provide those things. And for those of you who are attending my upcoming Sports PT Kickstarter, I'm excited for you guys, because those are the three things that you're going to get. I designed an 8-week course to give people accountability, weekly check-ins, goal setting, and clinical reasoning. That's selfishly why I created an 8-week online mentorship program. So if you find yourself stuck in your clinic and you're just not getting the outcomes you want, you're not seeing the athletes, it's because you don't have those three things. And if you're looking for those three things and not just another course on a couple ankle, taping jobs, or a couple mobilizations, or a couple McKenzie exercises, those things aren't going to get you out of your rut, out of the cycle that you're stuck in. And so if you're looking to get unstuck and really have a career path that makes sense, that is actually progressive and not doing in this wheel of traditional model of learning, I think if you've listened to my podcast about where the profession is going, this profession is going to in an interesting point in the next 1 or 2 years. And you need to figure out a way that you're not in the wheel with everybody else, in the hamster wheel, the same CU courses that everyone talks about, that no one really changes, that go to the same job and doing the same thing. And that's not you. You're looking for something different. You're looking for an environment that matches why you got into the profession, that matches your current passion, but you're surrounded by people who don't have that, who don't live in that, who are caught in the same hamster wheel. That's you. You're working inside those clinics. I know that. I know for a fact, because you tell me, the people I mentor, they're like, there's no one around me. And I need to, like, they feel that they want to be part of something bigger, but they just don't know how. They're stuck inside this wheel where everybody's like zombies in their clinic. They're just doing the same thing, wearing the same clothes, the same lunch they've been packing, doing the same 5 exercises they've been doing for a decade, just working that same process, not really thrilled about changing people's lives, just going to work to going to work. And if you don't want to be part of that, you need to get unstuck, and you surround yourself with other people. Give yourself the accountability, give yourself clinical reasoning, give yourself short-term and long-term goals. And that's what I'm here for. And that's why I built the Kickstarter. For those of you who've been doing the Kickstarter with me, who've done the other courses, and you're looking for, you want that in a monthly format, that's my academy. That's where you're going to thrive. Having me in your ear, for those of you who are in my academy and listening to this, you can smile because you get it, right? Like, everybody who's in my academy just listens to the same process every single month, and they are exponentially growing. Someone in my recent call last week just said, they're like, I really enjoy where I'm going, as I can see my growth over the last 6, 7 months. I think it was Grav. If you're listening, I'm very proud of you guys, and I love to see everything that you guys are doing. And it's only because you put yourself in a position where you're forcing yourself to have accountability. You're forcing yourself to create short-term and long-term goals, and you're having somebody there to give you clinical reason to figure out this is not where I need to spend my time. Stop taking these things, stop taking the courses, stop doing the podcast, stop doing these things, and just focus your attention that you need, not what you want. And if that's you, that's why you're stuck. So, all right, I'll get off my soapbox, but I wanted you guys, wherever you are on this planet, you're stuck. Some of you are stuck, and you need to get unstuck fast. And you need to surround yourself with people who are going at the rate that you want to be at or that you have previously been at. So, if that's for you, sign up for my Kickstarter, drchrisgarcia.com/Kickstarter. If you're looking for mentorship, drchrisgarcia.com/academy. If you are having a challenge and this is the next step, send me an email. If you want to have a one-on-one conversation, like if this is the next step for you, I'm happy to do that. Just send me an email, drchris@drchrisgarcia.com. My passion and obsession is changing people's lives, and you're not going to do it from where you're standing right now and not in the seat that you're currently in. And if you want to make a difference, because that's why you signed up to become a PT, I'm here to help. Send me an email, have a one-on-one conversation with you, virtual, live, I don't care. I just want to get in front of your face and push you in the right direction because I know you need it. All right, that's enough for me. That's my soapbox. I hope you guys are living the dream, and I will see you guys on the next episode. Take care.